Hey everyone, this is Dr. Andrew Hubbard, and today I'd like to talk to you guys a little bit about something that you don't hear about often, and that is non-alcoholic fatty liver disease. Now, non-alcoholic fatty liver disease is a condition that's on the rise, and more so in women actually, and it's actually becoming the leading cause of liver transplant amongst women. And so, what is non-alcoholic fatty liver disease? Well, it is basically a lifestyle condition. It is driven by factors such as your diet, carbohydrate intake, fat intake. We see it more commonly in people with diabetes and metabolic syndrome. So there tends to be a lot of diet-related components there that lead people to develop non-alcoholic fatty liver disease. But more recently, we're seeing now that there's a shift in the gut bacteria, and that shift in the gut bacteria can lead to fatty liver. Why is this important? Well, as I just mentioned, fatty liver can lead to a process where you start to get scarring and fibrosing in the liver, and that can lead to cirrhosis, which is a pretty serious condition in which the liver becomes completely scarred over and loses a lot of its function and can require a liver transplant. And so just to jump back to the gut bacteria, now how does that work? How does gut bacteria lead us to develop fatty liver? Well, it turns out that certain types of bacteria, specifically what we call gram-negative bacteria, they release, when they die, they release something called endotoxin. And endotoxin is something that, as the name implies, is a toxin to our body. And so when the bacteria in the intestine die and they release this endotoxin, this goes into the liver or into the systemic circulation. And once it reaches the liver, it basically starts to damage the liver over time. And so what do we take from this? So it means that, if you do have a finding such as fatty liver on an ultrasound, or if you run some routine blood work and it looks like your liver enzymes are elevated, this is something that you need to look a little closer at and maybe get a second opinion at if your doctor is not taking this seriously, because there can be some serious consequences, and it's important to take care of your liver health for sure.